Dentures serve as a lifeline for those who have lost their natural teeth, enabling them to eat, speak, and smile with confidence. However, the transition to wearing dentures can be challenging, and improper care or usage can lead to discomfort, oral health issues, and even damage to the dentures themselves. In this video, we will delve into the crucial do's and don'ts for new denture wearers to ensure a smooth and successful adaptation to dentures. Never skip regular cleaning. One of the cardinal rules of denture care is regular cleaning. Neglecting the hygiene of dentures can pave the way for a host of problems, including bad breath, oral infections, and deterioration of the denture material itself. Similar to natural teeth, dentures accumulate plaque, bacteria, and food particles throughout the day. Thus, it is imperative to establish a daily routine of removing and cleaning dentures, using a soft bristled toothbrush and a denture-specific cleaning solution. Avoid using regular toothpaste, as its abrasive nature can damage the denture surface. It's crucial to maintain the cleanliness of dentures through regular washing. But remember, products like toothpaste may contain ingredients that are abrasive or unsuitable for denture materials. Instead, stick to denture-specific cleaning solutions recommended by dental professionals. When cleaning dentures, always handle them with care to prevent accidental damage or breakage. Never wash dentures over the sink, without securing them properly, as they could slip and fracture if mishandled. Always place dentures on a stable surface, such as a sink counter or table, before cleaning to minimize the risk of accidents. By exercising caution and using appropriate cleaning products, you can ensure the longevity and hygiene of your dentures effectively. Never let dentures dry out. Dentures require moisture to retain their shape and ensure a comfortable fit within the mouth. When not in use, dentures should be stored in a denture-soaking solution or plain water to prevent them from drying out. Allowing dentures to dry out can lead to warping, discomfort, and an ill fit. However, it is crucial to note that hot water should never be used for soaking or storing dentures, as it can cause deformation and damage to the appliance. Never attempt DIY repairs. In the event of denture damage or loss of fit, seeking professional assistance from a dentist or denture specialist is paramount. Attempting DIY repairs using adhesives or glues can exacerbate the problem and compromise oral health. DIY fixes seldom provide a long-lasting solution and may render it more challenging for a professional to rectify the issue properly. Therefore, any concerns regarding denture maintenance or repairs should be addressed by qualified professionals. Always chew bilaterally. Proper chewing technique plays a crucial role in maintaining the stability and balance of dentures within the mouth. Unilateral chewing can cause displacement of the denture on the opposite side, leading to discomfort and instability. Therefore, new denture wearers should make a conscious effort to chew food evenly on both sides of the mouth to prevent such issues. Speak loudly and clearly. The initial days of wearing dentures may present challenges in speech articulation. However, consistent practice and perseverance are key to overcoming this hurdle. New denture wearers should make a concerted effort to speak loudly and clearly, allowing themselves to become accustomed to speaking with dentures in place. Losing confidence in speaking with dentures can hinder the adaptation process, potentially resulting in discontinuation of use. Manage excessive saliva production. During the initial period of denture wear, the body may produce excess saliva as it adjusts to the presence of the foreign oral appliance. It is essential to swallow excess saliva promptly to prevent denture dislodgement and discomfort. While this heightened salivary response typically diminishes over time, diligent management of saliva production is crucial in the interim period. Address sores promptly. It is not uncommon for new denture wearers to experience discomfort or develop sores in the mouth during the initial days of usage. These issues may arise due to improper fit or adjustment of the dentures. In such instances, it is imperative to consult a dentist for evaluation and necessary adjustments. Prompt attention to sore spots ensures comfort and facilitates the gradual adaptation to wearing dentures. And, last but not the least, never wear dentures while sleeping. Sleeping with dentures in place poses significant risks, including loosening of the dentures and potential obstruction of the airway, which can lead to choking. Before retiring for the night, dentures should be removed and placed in a jar filled with water to maintain hydration. This practice not only ensures the longevity of the dentures but also promotes oral health and safety during sleep. Transitioning to dentures can be a transformative experience, restoring functionality and confidence to those with missing teeth. However, this journey necessitates adherence to essential guidelines for proper care and usage. Remember, diligence and patience are key to a successful denture wearing experience.